Hi, I'm Dr. Deepa from AddressHealth. I'm here to educate you about probably one of the most common conditions right now being seen in Bangalore called hand-foot-mouth disease. So what causes hand-foot-mouth disease? It's a virus belonging to the group called enterovirus, specifically with the name of Coxsackie virus. So who gets it? Generally below 5 years of age group is most susceptible for this particular illness. Yes, adults can get it, but very less chances of an adult contracting the disease. So when do children get it? Typically after being exposed to the virus, about 3 to 5 days of incubation period, that is for the virus to multiply in the body before the child starts showing symptoms of hand-foot-mouth disease. And how does it start? It can start with a simple cold, cough, fever, and a throat pain. So how do you diagnose hand-foot-mouth disease? Very easy. You don't need a doctor to diagnose hand-foot-mouth disease because I'm going to tell you exactly how it manifests. So you will see that classically the blisters, they look just like chickenpox, but they're not chickenpox. Remember, blisters that are filled with clear water and classical distribution of palms and soles and elbows and knees and buttocks, and most, the painful part is the one which is in the throat. So the throat blisters are the ones which are extremely painful, which will not allow the child to be able to eat or even for that matter drink water. So you will see in a younger child who is drooling excessively with the little bit of fever and cold and cough, with the rashes on the palms and soles, you should suspect hand-foot-mouth disease immediately. So what do you do if you think that your child has hand-foot-mouth disease? First and foremost, stop sending the child to the school because your child is extremely contagious and can give the disease to many other kids, because the virus spreads through the contact on the surface as well as the respiratory secretions like the saliva. So stop sending the child to school. And secondly, liquids. So hydrate the child. Since the child is not going to eat well, you make sure you give cold things which are soothing to the child's throat, like juices or ice creams or milkshakes, till the child recovers. Remember, most important, this illness does not need any laboratory investigations. It's a self-limiting illness, which means it will go away on its own. In about 7 to 10 days, there will be a complete resolution of the rashes that you are seeing on the child's body. So manage your child well, and most important, do not send the child to school because the illness can spread to other kids for about 7 to 10 days after the first rash appears. So 1 week of infectivity period. So keep the child at home and manage the child at home. Thank you.